Dr. Douglas Reznick. I'm a medical oncologist at Rocky Mountain Cancer Centers. I specialize in thoracic malignancies, head and neck, and central nervous system malignancies. During medical school, I knew very early on that I did not want to become a pediatrician. My first day on the pediatric ward was spent in the oncology unit, and it was just too brutal. It was heartbreaking. So during my internship, I actually met a couple of my mentors who really showed me the beautiful side of oncology. What I like about it most is the comprehensive approach. I like working with thoracic surgeons, with the pulmonologists, the radiation oncologists. So it's become a much more comprehensive and in many ways optimistic field to be practicing in. It's not just all about chemotherapy anymore. Now that we've got targeted therapy and immunotherapy, it's made a huge difference in patients' outcomes and quality of life. For as long as I can remember, I've been involved in sports. My parents got me into team sports. As time went on, I eventually gravitated towards some of the more solo sports. The one piece of advice I make on a consistent basis to patients is to try and not let the diagnosis hold their life hostage. And I think it's important that patients do some kind of activity. But regardless of how limited you might feel, doing some sort of movement activity on a daily basis to keep your neuromuscular system engaged, to keep your mind active, is very important. I think I'm fortunate that being part of Rocky Mountain Cancer Centers, we've got a very strong clinical team, we've got a very strong group of social workers, of genetic counselors, diagnostics. So it's nice having the depth of care at Rocky Mountain Cancer Centers that we can bring to the community.